So in a very broad sense, I'm interested in the impact of aging in animals and age-related disease. And most specifically, we've studied for the past 20 years a disease in horses known as equine pituitary pars intermedia dysfunction, or PPID. And this is a disease of old horses that is a hormonal dysfunction. Because their hormones are dysregulated, they are immunosuppressed, so they can get diseases, particularly bacterial diseases, more commonly. Hormones affect so much of the body that when you dysregulate them and they're not being appropriately regulated, then you impact lots of different factors. And so quality of life is really impacted by PPID. And PPID is actually a neurodegenerative disease. So one of the hopes is, as we learn what causes PPID and some of the environmental or genetic factors that predispose horses to developing it, that may have some benefit in understanding neurodegeneration in people. What I find very exciting is when we come up with an answer to a question that has absolute clinical importance. So, for example, we've made some progress in the diagnosis of PPID, and that is used every day in clinical practice. I think it's important to recognize that we can do a really great job with our older animals, and through our research we have learned early identification of disease in our older horses and some preventative measures we can take and really make the quality of life better for our aged animals.